Today let's talk about hypertension, which is also known as high blood pressure. A person is said to be hypertensive if he or she has persistent elevation of BP or blood pressure. A normal or ideal blood pressure reading is 120/80 millimeters of mercury or less. Borderline if it goes from 120 to 139/80 to 89 millimeters of mercury. A patient can be diagnosed with high blood pressure if their blood pressure is consistently on 140/90 millimeters of mercury or higher. Why is it important to know if you have high blood pressure? Early detection of high blood pressure is very important. It is often referred to as the silent killer because it may show no symptoms. High blood pressure puts you at an increased risk for heart disease, heart failure, and stroke, among other things. High blood pressure can damage your health in many ways. It can seriously hurt important organs like your heart, brain, kidneys, and eyes. Signs and symptoms. If your blood pressure is extremely high, there may be certain symptoms to look out for, including severe headaches, nosebleed, chest pain, vision problems, fatigue or confusion, hard time breathing, pounding in your chest, neck, or ears, blood in urine, seizure. The best way to know if you have hypertension is to get regular blood pressure readings. Most doctors' offices take a blood pressure reading at every appointment. What causes hypertension? Several factors can contribute to hypertension, including genetics. Certain genes can make a person more susceptible to developing the condition. It means that if someone in your family has high blood pressure, you may have a higher risk of developing it too. Next is age. Individuals over 65 years old are more at risk for hypertension because as we get older, our blood vessels naturally become less flexible and more resistant to blood flow. Third is obesity. Excess weight puts additional strain on the heart, causing it to pump harder to supply blood to all parts of the body. This increased workload can raise blood pressure. Another factor is unhealthy diet, such as a diet high in sodium and too much consumption of alcoholic beverages. Fifth one is lack of physical activity. Regular exercise helps keep the heart and blood vessels healthy. It helps to reduce the stiffness of blood vessels and improve their ability to relax and widen, which promotes healthy blood flow and lowers blood pressure. Without regular physical activity, these benefits may be compromised, increasing the risk of developing hypertension. One more factor is stress. When we're stressed, our body releases stress hormones that temporarily increase blood pressure. If stress becomes chronic, these temporary spikes in blood pressure can become more persistent, leading to long-term hypertension. Next one, smoking. Smoking is a significant risk factor for hypertension. The chemicals in cigarettes can damage blood vessels and cause them to narrow, which increases blood pressure. Smoking also reduces the amount of oxygen in the blood, forcing the heart to work harder to supply the body's tissues. Other than the factors that have been mentioned, certain medical conditions, such as diabetes, kidney disease, and many more may cause high blood pressure. Treatment options. Treatment for hypertension typically involves lifestyle changes, such as adopting a healthy diet, regular exercise, limiting alcohol intake, quitting smoking, managing stress, and maintaining a healthy weight. Medications may also be prescribed by healthcare professionals to help lower blood pressure if lifestyle changes alone are not sufficient.